Most people believe a dementia evaluation is just a memory test. You sit in a doctor's office. They ask you what year it is, who the president is, and to count backward from 100. And based on that, a diagnosis is made. That is not how it works. Not even close. A proper dementia and Alzheimer's evaluation is one of the most comprehensive assessments in all of medicine, touching everything from brain imaging to blood chemistry to how you draw a clock. And yet most families walk into that appointment completely unprepared. They do not know what to expect. They do not know what questions to ask. They do not know what a thorough evaluation should include, which means they have no way of knowing if they are getting one. Today we are going to change that. These are the 5 things doctors look for in a proper dementia and Alzheimer's evaluation. Things most people never know about until it is too late to ask for them. Stay with me through all 5. Because number 4 is the one that most families never even think to ask about, and it could be the most important piece of the entire picture. Welcome back. I am so glad you are here, because understanding the evaluation process is one of the most empowering things a family can do. Here is what most people do not realize. Alzheimer's disease cannot be diagnosed with a single test. There is no blood test, no brain scan, no simple questionnaire that definitively confirms the diagnosis on its own. Instead, a proper evaluation brings together multiple streams of information: cognitive testing, medical history, laboratory results, brain imaging, and the observations of people who know the patient well, to build a clinical picture that is as complete as possible. This matters enormously, because an incomplete evaluation can lead to a misdiagnosis, a delayed diagnosis, or, just as importantly, a misdiagnosis. Other conditions can mimic Alzheimer's disease. Vitamin deficiencies, thyroid problems, medication side effects, depression, and even sleep disorders can produce symptoms that look very similar to early dementia. Knowing what a thorough evaluation looks like gives families the ability to advocate, to ask the right questions, to make sure their loved one receives the complete picture they deserve. Let's go through all 5 things. By the end of this video, you will walk into any evaluation appointment as an informed, prepared, and empowered participant. Thing 1. A comprehensive cognitive assessment. The cognitive assessment is typically the centerpiece of a dementia evaluation, and it is far more nuanced than most people expect. Yes, it includes questions about orientation, the date, the year, the current location, but a thorough cognitive assessment goes much deeper than this. It evaluates multiple distinct cognitive domains: memory, attention, language, visuospatial ability, executive function, and processing speed. One of the most commonly used tools is the Montreal Cognitive Assessment, the MoCA, which takes about 10 to 15 minutes and tests a wide range of cognitive abilities. The patient may be asked to draw a clock showing a specific time, to copy a geometric figure, to recall a list of words after a delay, to name animals from pictures, and to complete a sequence of alternating letters and numbers. Each of these tasks targets a specific cognitive domain, and the pattern of which tasks are easy versus difficult gives the doctor important information about which parts of the brain may be affected and how. What families should know. The cognitive assessment is most informative when it is compared to a baseline. If possible, having cognitive testing done earlier, before significant symptoms appear, gives doctors a much clearer picture of what has changed. If your loved one has not had a baseline cognitive assessment, asking for one at their next regular checkup is one of the most valuable things you can do. Thing 2. A thorough medical history and informant interview. This is a component that families often underestimate, but specialists consider it among the most critical parts of the entire evaluation. The medical history includes not just the patient's current symptoms, but their complete health background, previous illnesses, current medications, family history of dementia or neurological conditions, history of head injuries, cardiovascular risk factors, sleep patterns, and alcohol use. But equally important, and often more revealing, is the informant interview. This is a structured conversation with a family member or close caregiver who knows the patient well and has observed them in daily life. Why does this matter so much? Because people in the early stages of Alzheimer often lack awareness of their own cognitive changes. A phenomenon called anosognosia may minimize symptoms, attribute them to normal aging, or simply not notice what others around them have clearly observed. The family member or caregiver who has noticed the repeated questions, the financial mistakes, the personality changes, the withdrawal from activities, their observations are clinical data. They are not background noise. They are one of the most important inputs the doctor receives. If you are accompanying a loved one to an evaluation appointment, prepare written notes in advance. Document specific examples of what you have observed, with dates and descriptions. Bring that written record to the appointment. It could be one of the most valuable contributions to an accurate diagnosis. Comment below if you have ever felt that a doctor did not take your observations seriously as a family member, because that experience is far too common, and families deserve to be heard. Thing 3. Laboratory blood tests. Before attributing any cognitive symptoms to Alzheimer's disease, a responsible doctor rules out every other possible cause, and that process begins in the laboratory. A comprehensive blood panel for dementia evaluation typically includes tests for thyroid function, because both an underactive and overactive thyroid can cause cognitive symptoms. It includes vitamin B12 levels, because B12 deficiency is a reversible cause of memory problems that is frequently missed. It includes a complete blood count and metabolic panel, liver and kidney function tests, and glucose levels. Other tests may include folate levels, tests for inflammatory markers, and in some cases, screening for syphilis or HIV, which can both affect cognitive function. Here is why this matters so profoundly. Some of the conditions that can mimic Alzheimer's disease are completely reversible. A person with severe B12 deficiency may present with memory loss, confusion, and personality changes that look indistinguishable from early dementia, and with appropriate treatment, those symptoms may resolve entirely. This is not a rare occurrence. It is one of the most important reasons why a blood panel is not optional. It is an essential gate that must be passed before a dementia diagnosis can be made responsibly. If a doctor has suggested a dementia diagnosis without ordering a comprehensive blood panel, it is completely appropriate and important to ask why. And wait, thing number 4 is the one most families never think to ask about. And in many cases, it provides information that nothing else in the evaluation can. Stay with me. Thing 4. Brain imaging. Brain imaging is one of the most powerful tools in the dementia evaluation toolkit, and one of the most misunderstood by families. There are 2 main types of brain imaging used in dementia evaluation. The first is structural imaging, typically an MRI or CT scan, which shows the physical structure of the brain. Structural imaging can reveal brain shrinkage in regions associated with Alzheimer's disease, particularly the hippocampus and entorhinal cortex. It can also identify other potential causes of cognitive symptoms, strokes, tumors, hydrocephalus, or other structural abnormalities. The second type is functional imaging, most commonly a PET scan. A standard FDG PET scan shows how much glucose the brain is metabolizing in different regions. In Alzheimer's disease, characteristic patterns of reduced metabolism in specific regions can be identified, even in the early stages, before structural changes are clearly visible. More recently, specialized amyloid PET scans have become available. These directly detect the presence of amyloid plaques in the brain, providing a direct marker of Alzheimer's pathology rather than its effects. Not every evaluation requires every type of imaging, but structural imaging, at minimum, should be part of any comprehensive dementia evaluation. It rules out other causes and provides critical information about the pattern and degree of brain changes. If your loved one's evaluation did not include brain imaging, it is appropriate to ask their doctor whether imaging should be considered, and why or why not. Thing, specialist referral, and multidisciplinary assessment. The final thing a thorough dementia evaluation should include, or at least consider, is input from specialists beyond the primary care physician. Neurologists bring specialized expertise in brain diseases and are equipped to interpret cognitive testing, imaging findings, and clinical presentations in the context of the full spectrum of neurological conditions. Neuropsychologists conduct the most comprehensive and precise cognitive testing available, assessments that can take several hours and provide a detailed profile of which cognitive functions are intact and which are affected. Geriatric psychiatrists are particularly valuable when behavioral symptoms, depression, anxiety, personality changes, are prominent, as they can differentiate between psychiatric conditions and the behavioral symptoms of dementia. In some centers, a full multidisciplinary team, neurologist, neuropsychologist, geriatrician, social worker, and occupational therapist, reviews each case together and arrives at a consensus diagnosis. This team approach represents the gold standard of dementia evaluation. Not everyone has access to this level of evaluation, Geography, resources, and wait times are real barriers, but knowing that this is the standard and advocating for the most complete evaluation available in your circumstances is something every family can do. The dementia evaluation is not a single appointment and a simple answer. It is a clinical process, and the more complete that process is, the more confidence everyone can have in what it reveals. Let me speak directly to you for a moment. Whether you are preparing for an evaluation for yourself, accompanying a loved one, or simply equipping yourself with knowledge before you need it, what you have learned today matters. You now know that a proper evaluation includes comprehensive cognitive testing across multiple domains, that the family member's observations are clinical data, write them down and bring them, that laboratory tests must rule out reversible causes before a dementia diagnosis is made, that brain imaging is a critical component that provides information nothing else can, and that specialist involvement, neurologists, neuropsychologists, represents the most complete standard of care. This knowledge makes you an advocate, and in medicine, an informed advocate is one of the most powerful forces for getting the care that a loved one truly deserves.